Hi there and welcome back to the show. We definitely have some more great information from Kathy McPherson, who is a public health dietitian. So if you want to make sure that you're getting more information there, head over to www.drpeggymalone.com and make sure you get that really great information that Kathy has to offer. Joining me now is Ryan Meloche, who is the National Accounts Manager for Douglas Laboratories and Pure Encapsulations. And he is also a homeopathic doctor. Guy with a lot of great information. Welcome to the show, Ryan.
Thanks for having me.
All right, so I'm really excited that you're back again. Today we're going to talk specifically about heart health and how supplements can help with heart health.
Yeah.
So that said, that's my first question. How can supplements help with heart health?
Sure, it's variable. There's quite an array. There's several ways that it can help depending on the level of heart health or disease that we're dealing with a given individual. The applications vary from preventive health care to the management of cardiovascular risk factors such as homocysteine, or you might be dealing with C-reactive protein. You may hear your doctor commenting on some of those tests that they may run, but you may also be dealing with disease processes such as hypertension as well. So if you actually consider something like hypercholesterolemia or high cholesterol, there are some great opportunities in terms of therapeutic treatment through the natural healthcare sector. Phytosterols are something that our practitioners readily communicate with their patients regarding, because your body actually has a particular affinity for phytosterols over dietary cholesterol. So a lot of our practitioners recommend products that have phytosterols, and they suggest to their patient base to actually take them with a meal so that your body will uptake that phytosterol even over dietary cholesterol. And phytosterols...
So you'll be less likely to have cholesterol in your arteries, which is going to lead to cardiovascular disease.
And that's exactly it. A lot of our practitioners, there's great research that actually supports phytosterol use, and it actually mitigating or reducing the amount of plasma cholesterol, in particular LDL cholesterol that we heard Kathy speaking of, that being compromised at absorption. So you see less plasma cholesterol as well, in particular LDL that might be associated with coronary vascular disease. So we have products such as our Cardio Edge that has some great opportunity in it. It does contain phytosterols, but we actually incorporate pomegranate in there as well. And pomegranate is important in vascular integrity, resiliency, as well as permeability as well. But one of the major attractions in working with an elite company, you have access to those raw materials or those products that have fantastic science behind them as well. Citronol is a trademarked raw material in that product, and that has actually been shown to reduce total cholesterol by 24%, LDL by up to 22%, and triglycerides by up to 28% in a 4-week period. So it's quite impressive in terms of those offerings that we can offer within the natural healthcare sector.
So some really great alternatives to, sometimes dangerous medications that people are taking to reduce their cholesterol.
Definitely, yes. Yeah, there's some great options, and really being under the supervision of a qualified healthcare professionals, there may be able to be integrative care there as well. But you want to make sure that they are under the supervision, or someone is under the supervision of a qualified chiropractor, a naturopath, or integrative MD, a homeopathic doctor, a pharmacist, really to make some educated decisions there as well.
Yes, very important. That goes without saying. So you mentioned high cholesterol. What about high blood pressure or hypertension?
Yeah, hypertension, certainly there are some great options, and I would really reiterate in that case that they would be under the supervision of a qualified health professional. But we have, for example, in our line, we have something called Cardiostolix. Coleus and hawthorn, for example, are two herbs that really have some great opportunity in terms of having vasodilatory effects. So they're vessel relaxing effects, and what that does is reduces peripheral vascular resistance, so it helps with blood flow actually, and that would help to reduce high blood pressure, for example. Nattokinase, again, it's an enzyme that's created from the fermentation of soy cheese, is really where it comes from. But it does certainly support circulatory health as well. But what it's well touted for is its ability to reduce C-reactive protein, and we readily hear practitioners testing for CRP, or highly sensitive CRP, that C-reactive protein, and that's a marker for inflammation in the vessels, and that certainly is a risk factor for cardiovascular disease as well. But one of the major attractions in that product, again with the availability of some elite raw materials, is amyl peptide, and that's a hydrolyzed milk peptide is what that is. And interestingly, what it does is it supports our body's natural blood regulation mechanisms. So we hear of practitioners in the modern medical world recommending ACE inhibitors. So the amyl peptide actually acts as an ACE inhibitor, and it inhibits the production of angiotensin II, which has vasoconstriction effects, is what it does. So that may be a contributing factor to increased blood pressure as well.
Okay,
yeah,
really great.
There's many other ingredients in there, but I'm just featuring a few of those. But it really is a cardiovascular support formula focused at hypertension or promoting healthy blood pressure levels.
Okay, great. And if somebody has some concerns about their cardiovascular health, or if they just want to be preventative, what is sort of the core supplements that you would recommend?
Sure. I think I'll assume that they're on a quality multivitamin, because I think if anyone watched our past episode, I was very, very adamant on using a quality multivitamin. So assuming that, I'd probably say essential fatty acids, CoQ10, as well as D-ribose. We have a product called Corvalin, it's a trademark raw material, but it's a D-ribose product that supports ATP production or energy production, and that's very important in heart health as well. Essential fatty acids are a must in my opinion, because they actually have been shown to have a beneficial effect on essentially every cardiovascular risk factor out there. So important to support those risk factors and the management of those risk factors with the use of an omega-3 fatty acid in particular. I always promote omega-3s. There are applications for omega-6s and omega-9s. All these are good fats. But what happens in modern day society is the diets that we eat and the fast-paced lifestyles that we live and the food consumption that we have on that fast-paced lifestyle, we actually get so much omega-6 fatty acids from the foods that we eat. And there's a very fine balance between omega-3s and omega-6s in the body. And that should really be an omega-6 ratio to omega-3 ratio should really be somewhere in the 1:1 to 3:1 ratio of omega-6s to omega-3s. But with the high exposure of omega-6s from particularly the oils that we cook with, we're seeing in the range of 12:1 to 20:1, and you sometimes hear 40:1 out there as well. The major consequence of that is inflammation in the body. That may, in terms of cardiovascular health, mean platelet stickiness. It may mean hardening of the arteries. It may mean stroke. It may mean heart attack. It really is an inflammatory cascade, and a lot of our practitioners are really focusing on inflammation and its link to cardiovascular disease. So something like an omega-3 certainly would help to manage inflammation. Wobenzyme is fantastic at that as well. It supports the body's innate ability to manage inflammation in the body. So,
okay.
CoQ10.
We have only a couple of, I want to get right into CoQ10 because we only have a minute or so left. Coenzyme Q10 is important when people are taking statin drugs or cholesterol lowering drugs. Tell us why.
Hands down. Well, CoQ10 is a major energy producer for the heart. So it really is a core supplement in terms of when a practitioner thinks of cardiovascular health. When we age, as well as disease processes, our body makes CoQ10. It is a natural substance to our body, but in addition to when we are actually consuming a statin drug, it's very important, and there's application for statin drugs, obviously for high cholesterol, but what our practitioners always communicate back to their patient base or general society should understand is that when consuming a statin drug, that does compromise our body's ability to produce CoQ10. And again, just to reiterate, that's a major energy source for our heart. So we're taking we're taking a statin drug or consuming a statin drug to mitigate some of those risk factors associated with cardiovascular disease, but then we're starving the heart of its most highly concentrated energy producer. So it's very important to support heart health when you are on a statin drug to be able to supplement with CoQ10. My recommendation to anyone with cardiovascular disease, though, is to use a form called ubiquinol. That's the body-ready form of CoQ10 as well. So your body doesn't have to convert it, and it's readily used by the body to have a therapeutic benefit.
Okay, great. Thanks so much, as always, for your great information. We'll be able to find out all of those details on the website. And I want to thank also Kathy McPherson for joining us as well today. We want to finish off with our amazing health fact of the day. Because we're talking about your heart and your cardiovascular system, think about giving a tennis ball a good hard squeeze. That's about the same amount of force your heart uses to pump blood out to the body. The aorta is the largest artery in the body, and it's almost the diameter of a garden hose. Capillaries, on the other hand, are so small that it takes 10 of them to equal the thickness of one human hair. Your body is an amazing machine. Make sure that you take care of it. I'm Dr. Peggy Malone. Until I see you next time, live well.